Hello, everyone, and good evening. This is Aarti Mishra, this side from Team ClinSav, and I'll be your host for tonight. Before I start, we'll give a short introduction and a welcome speech, and then we can go ahead with the webinar. A warm welcome to all of you to today's enlightening webinar hosted by Gyan Vardhini. This is session 5. We are thrilled to have each one of us joining today. What promises to be an insightful and enriching session. In today's fast paced world, the pursuit of knowledge is more important than ever. It is a quest of knowledge that drives us to continuously seek the perspective that can help us grow both personally and professionally. So, today's webinar is entitled as Relevance of step, Stepopathic in Clinical Practice, and it is designed to empower you with valuable insight and practical knowledge that you can apply in your daily lives and professional endeavors. Our today's uh, webinar is being presented by Dr. Shahin Mohan. He represents the fourth generation of a traditional Ayurveda Vaidya family called as Thalapully in Palakkad district from Kerala. He is currently the chief physician and managing director at Thalapa Ayurveda. He has completed BAMS from Ramakrishna Ayurveda Medical College. After his graduation in the year of 2009, he has been exploring different systems of medicine and has been effectively integrated them into his practice. Since March 2018, he has been conducting workshops for doctors in the name of Samanya Vaya to, to integrate, educating doctors how various therapies can be used judicially, along with Ayurveda to give faster and better results. Art of Cupping, a workshop that deals with A to Z on cupping therapy, is another workshop series from the House of Samanya Vaya. Webinar of the same name is currently going on. He specializes in acute pain management at OPD level. Since Jan, he has started conducting a 3-day workshop on osteopathic manual techniques exclusively for doctors in different cities across India. We welcome you, Dr. Shine Mohan, and over to you. You can start with your webinar.
Thank you so much for the introduction, Aarti. And I hope I'm audible, and I hope you can see
Yes, sir.
my PowerPoint is also up and fine.
Yes, sir. Yes, sir.
Yeah. Okay. So, a warm good evening to all the participants. I know it's just all my. I hope everyone have reached back, or some are getting back from their OPDs who are doing late OPDs. So, the topic that I'm going to do today is osteopathy in clinical practice, or the relevance of osteopathy in clinical practice. Now, just like every Ayurveda doctor or every medical student, once you finish your college, you're always, you have a lot of anxieties and a lot of insecurities and how to do, what to do, what sort of practice you have to begin and all that. And right after my practice, even I was like that. And but somehow I was always very keen, or I would say I was lucky that I had just one attitude that actually helped me reach where I am. That was I just said to myself that I don't know anything, and then I wanted to learn a lot. I don't know what, but I want to learn, and that curiosity was so much in me that I would literally go and try to learn anything and everything that I didn't know. And one thing led to another, and then I started developing interest in certain areas, and then I started working on it, and like that, one thing led to another, and finally, I'm here in this wonderful world of osteopathy. So I really wanted to share my journey as to how you can all, this is basically what I've done for the past, 10, 14 years. I've just concised it and I've brought it under the label of osteopathy. Osteopathy itself is a 5-year course. It's not there in India. I think only Sri University in Bangalore has an MSc and a BSc osteopathy, which is again, 4 years and a 1 year internship. And MSc program, I think it's 3 years. So in the US or in abroad, it's a 5-year course, just like a medical thing. So what is osteopathy? We'll just begin. A small prayer to Lord Dhanvantri. Om Namo Bhagavate Vasudevaya Dhanvantri Amrita Kalashastaya Samaya Devashaya Dharoganathaya Dhanvantri Mahavishnu Namo. Om Sahana Bhavatu Sahana Bhunaktu Sahaviryam Karavavahe Tejasvinavadhinamastu Mahavidvishavahe. Om Shanti Shanti Shanti. All my presentations begin by paying my respects to my, forefathers. I was born in a family of Ayurvedic doctors. I represent the fourth generation. And this is my great grandfather, Sri Talapully Ayurveda. And, I always, those who have attended my workshops know that I always begin my sessions by paying my respects to them. So this is a picture that I always show everyone. This person is an elderly person. He's about 90 years old, 88, 89 years old now. And about 4 to 5 years back, he came to me for a low back pain, and he's from my village. And earlier I used to know him as a very senior most person in the village, and he was like a family friend. But it was when he had a back pain, when he came to me for that treatment, that's when a patient doctor relationship happened. And then he showed me this spot in the ear. You can actually all see there is a small, a small dip like thing in the ear. And he was telling me the story that when he was about 3 or 4 years old, he had an acute colic pain. And then he had come to my grandfather and he did Agni Karma using a shlaka on the ear. So, Agni Karma for acute ear of colic pain in the ear is something that actually, I had no clue, and I was really interested in, because Agni Karma is practiced widely as an acute pain management tool, and most of it is done like locally, like the area of pain, and that's exactly where you do the Agni Karma. But for a colic pain in the ear, I had no idea how it works, right? And it was later when I heard there's something called as ear acupuncture that I see that there is a connection. Uh, And this is my grandfather, Sri Ramanguti Vaidya. A lot of Vaidyas in olden days used to come to a house, and they used to study in a Gurukula system. This is my grandfather's brother, Dr. T.K. Uni. After doing his MBBS initially, I'm sorry, Ayurveda, he went on to do an MBBS and he retired as a district medical officer. And he was the first one to do vasectomy surgery in my district. So just great, I've been blessed to be born in the family, and then I try to, pay my respects and also try to live up to their name if the best I can. A good standing posture. Now, what is osteopathy? Osteopathy is something that connects mind, body, and soul. And when we look at a patient, what can we see? When we look at a posture, what can we identify, right? And in Ayurveda, we talk about the Trivida Pariksha, which is Darshana, Sparsana, and Prasna. And in the Darshana aspect, we only look if there is, let's say, a growth, or let's say an inflammation, if there is edema, if there is growth, and let's say if there is some in the eyes, if there's reddish coloration, if there is any deviation of, if it's like a Bell's palsy, if there's deviation irregular in the face. And these are the things that we actually do, but we don't see a person's posture as such. A lot can be diagnosed from a posture. So what is an ideal posture? An ideal posture is when you can see this lady standing straight, and when it's called a plumb line test, where you tie a string and then you put a weight under the string and you just let it hang, and you make the person stand just behind the string, so that the weight is just right next to the lateral malleolus. So when you look into this picture, what you can see is if you draw a straight line from the ear to the lateral malleolus, right? The string will pass from the external auditory meatus, the shoulder joint, the cricoid process, the elbow joint, the hip joint, just behind the patella and the lateral malleolus. So that is ideally how proper posture should be like, right? And you have way too many variations in this in daily practice. You see people who use a lot of mobile phones, they have these forward flex posture or, like that. That means the head forward posture where people use so much of mobile phones. Those in the computer, you have the rounded shoulders. So all these postures can tell you about the imbalance in the muscles that is there in the body. And you can probably guess what are the symptoms that this person is suffering from. So, what is osteopathy? Osteopathy is based on the principle that the well being of an individual depends on the skeletal, muscles, ligaments, and connective tissues functioning smoothly together, right? Philosophy and principles, every human is a unit of body, mind, and soul. The human body is a whole integrated organism in which all parts function independently. The body has its own self regulatory mechanism and is capable of self healing and health maintenance. The well being of a person depends on the proper, smooth functioning of all structures in the body, including bones, muscles, tendons, ligaments, and organs. Now, as Ayurvedic doctors, even we have the same concept of, body, mind, and soul, and we talk about what is health, samadosha, samagnishta, samadhatmalakaya, prasanna atmendriya mana, swasthati priya. So we include the prasanna atma indriya and mana, which is again the good aspects of mind and soul. And then we also have the samadosha, samadhatu. And what is samadhatu? We have we always take it as dhatu, vriddhi, and shaya. So in the context of osteopathy, I would like to add another concept that when you talk about dhatu, it's not just vriddhi and shaya. You should try to think its function as well, right? What is the function of a muscle to move, right? If the functionality of that dhatu is also affected, the karma of that dhatu is affected, even then there is a condition in the disease. That's what we try to think or the thought process that should be in your mind when you're considering osteopathy. That is where you're going to add osteopathy, right? Because people come to us with stiffness of joints or lack of range of motion, right? And what do we do? So when there is a lack of range of motion, we say there is no movement. We say there is a stambhana. I say it's a vata vyadhi is it's a vata vyadhi. There's no movement of vayu, and we correct it based on medicines there. But also we are also indirectly enabling the smooth movement of the organs or the muscles or the tissues and then enabling that joint. So that is exactly what we are doing, even though we consider it as the removing the block and making the vayu move. And that's what we mean. So we're going to think more on the anatomical level when you think about the osteopathy. And that's where you're going to add it. So history. Manipulation has been widely practiced in many cultures throughout the world for thousands of years. Kalari and Marma specialists have been doing it in Kerala and Tamil Nadu till date. So, in Kerala and Tamil Nadu, Kalari is something, it's like a martial art, and, everything is based on Marma and Nadis in Kalari. So, the acute injuries used to happen only in the practice of Kalari, which means when people were practicing martial arts, they used to have those acute injuries. And so the Kalari teacher was well versed in the marmas and, how to correct them, how to manipulate them. And they were the ones who were doing all these manipulations, right? So they were famous for managing conditions or injuries related to musculoskeletal conditions. It was more the specialty of a Kalari or a Marma specialist. And they were also the ancient, ortho specialist as well. In Europe, Hippocrates was the first physician to describe manipulative techniques. In the mid 1800s, Dr. Andrew Taylor Still, the founder of osteopathy, was first introduced manipulation as means to treat variety of conditions. Now, when you talk about manipulation, because there is so much of information on the YouTube, and there is so much of demand, and what do you say, uh, trending videos you get to see about chiropractors, everybody thinks that manipulation is just correction. When you talk about manipulation, it is everything. It is not just a chiropractic correction. It is also how you regulate the movement of the muscle. You're also manipulating the muscles. You're also manipulating the viscera. When you consider the visceral osteopathy, you're manipulating the fascia. So there is a lot of things you're manipulating. It's not just the chiropractic correction. So as doctors, we should get the broader sense of it. If a layman, when somebody speaks, it's a manipulation. It's just that cut that we see in the videos that is very famous, but that is not what we're referring to here when you're talking about manipulations, right? So Andrew Taylor Still, he is known as the founder of osteopathy. And this is a very interesting picture that actually sums up a lot of how powerful osteopathy is, or the concept of osteopathy is. So if you can see this picture, you can all focus on the head of this person. This is Sir Andrew Taylor Still when he was about a boy. His father was a farmer, and he says in his biography that when he was a boy and he used to assist his father in the fields, and whenever he had headache, he tried to his head was hurting so much. So one day he tried to draw a rope, and he tried to make a swing, and because it was too high, he was not comfortable, and then he tried this method. So if you can see, there is a rope that is about 8 to 10 inches off the ground, and then he has put a blanket, he has rolled a blanket or a cloth on top of it, and then he's just resting his head there, right? And you can see his in his he clearly explains it. One day when about 10 years old, I suffered from a headache. I made a swing of my father's plow line between two trees, but my head hurt too much to make swinging comfortable, so I let the rope down about 8 to 10 inches off the ground, threw the end of the blanket on it, and I lay down on the ground and used the rope for a swinging pillow. Thus I lay stretched on my back with my neck across the rope. Soon I became easy and went to sleep, but got up in a little while with headache all gone. So whenever he just tried it, to make himself comfortable, and then he realized that his headache was all gone. Uh, As I knew nothing of anatomy, I took no thought of how a rope could stop headache and the sick stomach which accompanied it. So this is what is very, very interesting. He's saying that whenever he was trying his head, he did this, and not only did his headache go, but whenever he had the headache, he also had a sick stomach. So even his sick stomach used to be cured by just resting his neck on the rope. After that discovery, I roped my neck whenever I felt those spells coming on. I followed that treatment for 20 years before the wedge of reason reached my brain, and I could see that I had suspended the action of the great occipital nerves and given harmony to the flow of the arterial blood to and through the veins, and ease was the effect, as the reader can see. Now, what he has done is, by mistake, he found out that whenever he had this pain, and if he just, you know, uh, tied a rope and he put a blanket and he was resting his neck, that is the suboccipital area, just below the skull. And when he was lying down, he could feel that the headache was getting relaxed, and at the same time he was feeling his stomach issue was also resolving, right? And then when he went on to do osteopathy, when in his medical school, he realized that he was actually suspending the action of a great occipital nerves and given harmony to the arterial blood to and through the veins, and ease was the effect, as the reader can see. So in other words, what you can also think about is, there was a stambhana, and what he has done is he has actually done unknowingly, he did like a manipulation in that fascia, which relieved that blockage and which improved the blood circulation and which reduced his symptoms, right? And this is exactly what we every doctor, irrespective of every, the field of practice, everyone, we do it through medicines, right? And we expect the same results, or this is why we give medicines. We understand the disease. If it's a, headache, migraine, we take from the history taking, you do all the, different parikshas, and then you realize it's because of the stomach. Then you also give some, the concept of pachna, deepna, all that, and for the stomach, and also you give some local, and like how we generally practice. This is the whole goal, is to try and help the patient. But here you also have an option to actually do an external manipulation to correct it, right? And that is why we should understand the concept of fascia and osteopathy. Andrew Taylor Still's favorite quote is, knowledge of anatomy is only a dead weight if we do not know how to apply that knowledge with successful skill. And I personally, I've asked many doctors, but I think many would certainly agree that after the first year Viva voice, very rarely we touch anatomy books. If you're doing an anatomy Shari Rachna MD, this maybe you do it. Or if somebody is into ortho, ortho practice, yes, you might do it. But majority of us, even, we focus more on the medicines and, the clinical aspects of it. But the plain anatomy, biomechanics is something that doctors generally not do it, right? And true knowledge about muscles and its action is absolutely essential for treating musculoskeletal conditions. Sorry, thorough knowledge about muscles and its actions, right? And knowledge about trigger points is essential to effectively treat the different conditions of the muscles, right? So we're just going to connect all the dots and then bring it all under the big umbrella of osteopathy. So that's the whole idea of my webinar, to introduce you to these concepts that is there, these, phenomenon, if I could call it, in the body that is happening, and we've been treating it without actually calling it, the specific name. We've been treating trigger points using, the Svedanas, the Abhyangas, the Potlis, the Bastis, the Kadibastis, the Dharas, all that. We've been doing it, the Lepanas, whatever we've been doing, we've been treating the trigger points, but we've not called it as a trigger point as such, right? So what is a myofascial trigger point? And myofascial trigger points are present everywhere and affects as much as 85% of the population at some time in their life. And this study was done in 2010. But when you come to 2024, I think, I don't think, but I'm definite that, myofascial trigger points are present everywhere and affects as much as about 95 to 97% of the population at some time in their life. Because post-COVID era, everybody are sitting down, and then we have the best friend that is the main cause of everything, people don't watch TV anymore. TV serials, series, mobile movies, everything is in the mobile phone. So you are always looking in the phone, right? Irrespective of what you have to do. If you're studying, you're on the phone. If you're, browsing, if you're on social media, you're on the phone. If you're watching movies, you're on the phone. If you're making notes, you're on the phone. If you're watching serials, you're on the phone. So the phone has become such an integral part, and everybody who is using a phone will definitely develop, trigger points in the body, right? It is also present in babies and children. And the impact of myofascial pain on health can be severe, as patients not only suffer from pain and loss of function, but also from impaired mood and decreased quality of life, right? And that's what I just, the definition of swastha, prasanna atma in indriya mana, it is not there. People, because of the pain, they're just so, what do you say, disturbed, and they come to you with, reports from various hospitals, and I'm just sharing what I see in my clinic. They go to these, premium hospitals with great labs, and they do all their complete, the checkup. They do the package thing, and they come and they find out that they are perfectly normal, and with the investigation reports, but the x-rays are normal, the scan reports are normal, the blood reports are normal, but people are in pain, right? And that actually becomes even more depressing, because people are like, I'm in pain, the doctor is not able to find out what is with me, and then I have a serious issue. and then they talk to the spouses, if it's especially if it's a lady patient, and then you suddenly see that yes, the spouse is very very, what do you say, very caring, and then he takes the doctor, and the doctor finds out that she's perfectly all right, and then suddenly the spouse is like, "Arey, it's just a psychosomatic," and that's it, and there ends the most thing, and this is what happens. The musculoskeletal conditions that people have, and they're not able to describe it. And most of the times, what happens is that people are not able to explain what they're feeling. And this is why, it's a very tragic thing. And I have patients coming, say, doctor, I'm trying to tell them, and my kids and my husband, sorry, husband and my kids are like, teasing me, saying that it's just a psychological issue. And anyone who touches the body should have a thorough and deep knowledge of trigger points, right? So, uh, the question is, when you talk about trigger points, but do we have any trigger points? I would like to ask a couple of you all to actually unmute and just respond, because it's been about what, 15, 20 minutes, and I've been just doing it monotonous. I don't know if people are still there also. Okay. Since I didn't receive any call from Ati, I'm sure, yes, I'm still connected. So all you can do is you can just take your hands and, you can just try and press your, this shoulder area. You can just tell me if uh, you can just check. Do you feel anything? Somebody can actually unmute. You can just look here, right here, just behind this area. Do you feel any pain, or do you feel any stiffness or tightness or anything that you can feel? You can just.
Yeah. Hi, everybody. This is Anand here. Dr. Shine, we have allowed people to unmute themselves so they can actually, respond back to
Okay.
you.
Yeah, I'm sorry, I didn't know that they were unmuted. Okay, so yeah. We have about 20, 23 people. None of you all have this, and I think then we should just stop the webinar, because then you're all perfectly fine, and there's no point in doing the webinar, because. So how many
There
of
is
you all?
Doctor,
Yeah.
Yes, yes, I am Dr. Snehil Shainji. I
Yeah,
have
yeah.
some, yes, the point you said, where there is some tight points. I cannot explain it, but it is very tight and it is tender, minutely tender.
Yeah, minutely tender. And you didn't know it was there, did you?
No, actually, I knew it was there.
You knew it, yeah, because you're all behind it already. So anybody else, what happens is you don't know it unless it starts affecting you. That's the whole idea. Was I'm trying to say that, yeah. And then you realize how and people come to us with the same pain, and then when you look at this area, especially, the trapezius is where you're sitting, you're with the forward, your hands like this, the rounded what do you say, shoulder that actually affects. And so uh, what happens is, people, they come to us with this pain, and then if as doctors we don't understand this, we don't empathize it, it's very tough to treat, and it's so they're just going to go from places to they're just going to change doctors till they find the best care, right? And that is why, if you understand what is the trigger point, if you understand that things, there is a simple way of treating it. Even if you do an Abhyanga Svedana, you can focus on the area that you have to do until like how long you have to do, how much you have to do, what is the expected result, end result that you should do. Now, what the thing is, we don't have a we do look for the samyak lakshanas, we do it for snehapanas, we do whatever internal snehas we do, but when it comes to massage and these portlays, it's the patient's feedback about the pain actually, that is where what decides when we stop the treatment, right? But now what you can actually do is you can actually look and feel and see that, how it reduces, how the stiffness varies, how the stiffness reduces, and then you exactly know that, only when it is completely gone will there won't be any chances of any recurrence, right? So we can also educate the patients, right? So I'd like to show you a picture about John F. Kennedy, and this is John F. Kennedy, and according to his mother, he nearly died of scarlet fever at 2 years, whooping cough at 5 years, digestive problems at 14 years, diagnosed of hypothyroidism at 17 years, and a spinal accident at 30 years. He was almost completely bedridden, right? And then on the right hand side, you can see John F. Kennedy's pain map. Now, when you talk about trigger points, you're also going to talk about pain map, because every trigger point in the muscle will have a pain map, right? And that pain map is what the patients will come to you, and your job is to find out which is that pain map and which muscle it is being related to. That is what your job is. So you need to understand uh, what trigger points are. You need to understand what the so you need to understand what the pain maps are, because the patients are going to come with a pain map. So you should have an idea, and then you give a good treatment based on that, right? So you can see on the right hand side, John F. Kennedy's pain map suggested, erector spinae, bilateral, lower, gluteus maximus, minimus, medius, both sides, tensor fasciae lati, both sides, gastrocnemius, and both sides. So we'll have a couple of slides where you'll get a better, understanding. Is someone trying to say something, or it's fine? Can I continue?
Yes, sir, you can
Uh,
continue.
Okay. So what are trigger points? As definitions, trigger points is a highly irritable localized spot of exquisite tenderness in a nodule in a palpable taut band of skeletal muscle, right? And it was done by Janet Trevell and David Simmons. So there is a skeletal muscle, a muscle strand or a muscle fiber, and within that muscle fiber, you have something called, it's like a nodule, and that is what a trigger point is, right? And myofascial trigger points are those trigger points that are found in a specific muscle and its fascial wrapping, right? So I'll just play this video.
So is there any sound to this video?
Yes, you're not able to hear
We
it?
cannot hear it. If you can just check it once.
Uh, is there a setting that is just not there in there? I'm using Teams for the first time, so I'm a little no, my
The-
mic is on, my camera is on. Is there any setting that needs to be?
Just a second, I'll just check back.
Is it video settings or settings, device settings? No.
Can you check in the just a second? If you can just check in the audio setting on
In my
Teams,
in my computer or in the Teams?
in the Teams.
Where can I find the audio? I can see the mic camera. Is it on more?
Yeah, you if you can see the more option, more actions,
Yeah.
you can click over there, and there is a audio setting.
See an audio setting. There's device setting. There is accessibility. There is settings.
Over there also, if you get an option of like include system audio or something like that.
No, let me just the options I'm getting right now are record and transcribe, meeting info, video effects, language and speech. Is that the one?
You're not getting the audio setting.
No.
I'll just check again.
Q&A spotlight. Will it be in language and speech? Or that's okay. I can explain it. I know, just not.
Okay, so you can go ahead then, because I guess you're not getting that option in your device.
See if I play it in this, are you able to listen?
No, sir, the voice is not audible.
Dr. Shine, just close your screen share, and when you again start the screen share, there will be a checkbox in the bottom which may say that audio including.
Yes, including the
Yeah,
audio.
I think I remember seeing that. I'll just take.
You can leave and you can connect
Yeah.
back again.
Yeah, I think I got it. Yeah, include sound is there. Yeah, fine.
Yeah, you got it. Yeah.
Yeah, let's do it now again.
Thank you, Dr. Snail.
Many people suffer from pain and physical problems. Very
It's
few
okay now?
people know that these
Yes,
problems
we can
are
hear
often
it.
related to trigger points.
Thanks.
Understanding and treating trigger points helps to lessen pain and improve overall health. This video is a short explanation and introduction to the trigger point. A trigger point is a small muscle contraction which can be felt as a small nodule. Pushing on this nodule is very painful. Trigger points can exist in each muscle of the body. Multiple can exist at the same time. Often both sides of the body are affected equally. The trigger point keeps the muscle tight and weak, restricting the muscle's range of motion. A trigger point can actively cause pain, or it can cause no pain unless touched. Mostly this pain is sent to a different area of the body. This is called referred pain. Referred pain can make finding and treating trigger points difficult. Luckily, referred pain follows typical patterns that have been well documented. Let's take a closer look at the trigger point. A trigger point lies in a taut band. A taut band is a tight strand of muscle that feels like a cord, easily mistaken for a tendon. The trigger point itself can be felt with the fingertips when its location is superficial. The size varies from a pinhead to a pea. When we continue to zoom in, we can see the muscle fibers that make up the muscle. The lines on the muscle fibers represent sarcomeres. Millions of sarcomeres, acting like tiny pumps, have to contract to create movement. Sarcomeres can become overstimulated and unable to release their contracted state. This knot of contracted sarcomeres shows a segment of the fiber that has become shorter and wider because of this. But also a different segment now becomes stretched by this tension. shown by the greater distance between the sarcomeres. Together, multiple of these sarcomere knots form the trigger point. The stretched segments of the fibers give tightness to the taut band in which the trigger point lies. When sarcomeres are stuck in contraction, blood flow stops in the immediate area. The resulting oxygen starvation and accumulation of waste products irritate the trigger point. The trigger point responds by sending out pain signals. In return, your brain will stimulate you to stop using the muscle, which further shortens and tightens up the muscle. Trigger points will not release without proper treatment. The most effective way to treat a trigger point is applying deep stroking massage directly to the trigger point. This can be done without the help of others. Deep stroking massage means performing a series of deep strokes across the trigger point nodule. In this example, a rubber bouncing ball is placed between the body and the wall to reach the trigger point in the lower trapezius on the back side of the body. You can see the ball moving slowly and deeply in short strokes from one side of the trigger point to the other. Series typically consist of about 8 to 12 strokes and are performed about 5 to 10 times a day. By using deep stroking massage, you are milking the trigger point, so to speak. Blood and lymph fluid is moved out containing waste generated by the contracted muscle fibers. Each time you move over the trigger point and release the pressure, fresh blood immediately flows in, bringing fresh oxygen and nutrients. It may take several weeks to return the muscle fibers to their normal state and fully release the trigger point. Trigger points which have existed for a long time will take a lot of treatment, but often results can be achieved in days, meaning less pain and improved mobility. You can find references to more in-depth information about trigger points and their treatment in the video description below.
This video is available on YouTube. It's free. You can just go and look at it, and I think it's very simple and straightforward, right? So there is a trigger point and there is a pain map, and every muscle has a different pain map, and it's well documented. So you can easily go and just uh, study about it, look into it, and you can find this. And so, what are the characteristics of trigger points? Pain, often exquisite, is present at a discrete point. A nodule is embedded within a taut band in the muscle, right? The nodule is within the muscle. Pressure reproduces the pain symptoms with radiations in a specific map. Now, this is very interesting. People come to us with headaches, and so with headache, there are a set of muscles which could be the reason, the trigger points in those muscles could be the reason of the headache. So when you identify those muscles and when we try to palpate it, and when you press it and you suddenly realize that there is a pain map that develops, and patients are like, doctor, when you just pressed it here, I got that same pain that I used to normally feel, right? And that gives a lot of confidence to the patient. He feels that at least the doctor identified exactly what I felt. And then pain cannot be explained by findings from a neurological examination, and that is again very, very interesting that you go to all the doctors, like, modern doctors, they say it's completely fine. The scan reports, everything is fine. So ideally, you should not have any pain. But, people have the pain, right? And may induce autonomic changes. And that is why it is so important. When there is a trigger point, there is also change in the autonomic nervous system, right? So how do you find them? So I'll just give you, this is like not in detail, but I'll just tell you how you can usually find these trigger points using your finger pads, flat finger, use pincer palpation, this is called, and flat hand and elbow. And you can see a lot of videos where people actually use their elbows to identify a trigger point and try to release it as well, right? So what are the therapeutic technique protocols, for trigger points? It's injections are used, but that is very rare. And you use dry needling. Dry needling is nothing but you insert a needle on the trigger point. You just hold there for about 10 minutes, and then you just leave it, and it heals by itself. And then there is the spray and stretch technique, which means you just stretch the muscle and then you put some sprays. And then there is the hands-on techniques and stretch and release techniques. Okay, so I'm not going to go very detail about trigger point therapy because it's very lengthy asset. So there is ICT, or inhibition compression technique, and what we do is in inhibition compression technique, what we do is we use your hands to actually compress and create an and you inhibit the flow of the blood there, and you hold it for about 30 seconds to 2 minutes, and then you wait for the body to actually just correct it, and you can just feel it releasing in your body, right? Use trigger point tools like, you can see, I'm sure you would have seen this, like how that in the video he was using a ball to actually just move from here and there to squeeze the muscles and the stagnant fluids there. Cupping for therapy for trigger points is also very effective, where you place cups on different muscles and to treat it. Then there is deep stroking massage, and also there is manual lymphatic drainage. Okay, so just to understand, we just talk about a couple of muscles and how you derive a protocol based on trigger point therapy. So you have your sternocleidomastoid muscle here. Sternocleidomastoid. To understand trigger point therapy, we need to understand the action of the muscle, that is and also the origin and insertion, right? So we'll just talk about a couple of muscles. I will not go in detail because we don't have that much time. Just talk about sternocleidomastoid. The origin is from the sternal head and the clavicle head, and the insertion is the outer surface of the mastoid process of the temporal bone, right? And the action is contraction of both the sides forward, flexes the neck, and on one side it actually does the function of looking over the shoulders, right? And what you can see in this picture is, you can see these blue dots are the trigger points of that muscle and the pain map of that. So you can see when there's a trigger point in the sternocleidomastoid in this area just below there is likely chances of headache or around the eyes, etc., right? And trigger points of are it can form based if there is an improper what do you say, posture, if there is overstrain of that particular muscle, when improper bath timings, all these leads to formation of trigger points in the muscles. Okay, and another interesting muscle is the scalenes, and you can see that scalenes muscles, the origin is in the transverse process cervical in vertebral, insertion is the anterior and medius rib. And the pain map is also very interesting. It's just below, it's towards your chest and then towards your hand. And mostly people will run to us coming saying that, they have an angina, like a heart attack or something. And then when they go see ECG is perfectly normal, and still they go to a cardiologist and he would just give some random medicines, and still they don't get relief because they have this radiating pain, right? And you can also get a very clear understanding of the cause of the radiating pain is because of the muscles of the scalenes, right? The scalenes group of muscles. And here also you have the posterior cervical muscles. So I'm just going to name it and go because we don't have that much time. And the anterior cervical muscles, the splenius capitis, right? The extensor group of muscle, and you can see the splenius capitis muscle is here, and you can see on the lower side, you can see the pain is towards the eyeball, even though the trigger point is there at the back. Okay, and then you have your splenius cervicis muscle. Just gonna, you can just look. There's a lot of information available online. You just have to go look into it. And then trapezius, a favorite, and the one that we just saw is mostly the trapezius that has the trigger point, right? And you can see the pain that is there, and it's exactly what patients come to us today, right? Levator scapula, you can see the blue dots is the trigger point, and the pain map is that orange color that you see. Rhomboids, very common. Like, people come to us with that pain, especially ladies, at the back, and then there's that pain near the scapula area. Sometimes it's very stubborn, right under the arm. It's nothing but serratus anterior. Pectoralis major. I have cases like, one of my doctors who attended my workshop, he just went back and, the first case he got was somebody coming with the pain in the chest. And then, he was a cardiac patient. He was already taking medicines, and he went to a cardiologist, and he saw it's perfectly fine. But then, he was not getting relief of his pain. So, and then he came to his doctor. So he just tried this for the first time on the chest, and he says that almost instantly he felt that relief. And that's the best part of this trigger point therapy. You do a treatment, you release the trigger points, and then the pain is gone. And very rarely it comes back. Unless, of course, if there is the root cause of it could be posture or something else that you've not addressed, and then only then it will come back, right? Otherwise, it's a permanent one-time treatment, right? And then there is all these muscles, latissimus dorsi, deltoides. I just want to name the muscles so that you can just refresh it quickly. Supraspinatus muscle, infraspinatus muscle, especially radiating pain, lateral pain in the elbow, this radiating pain. People come to us, this is, this radiating pain. It's all due to, the muscles of the upper back, right? The teres minor, subscapularis, teres major, biceps brachii, and triceps, right? So we need to understand what are the muscles. We need to understand uh, the surface anatomy of the muscles. We need to understand, where the location of each muscles. We need to understand the action of the muscles, right? So once we know that, then we can definitely create, a protocol. And we should understand that these skeletal muscles work together to create and reverse muscles. So you have the three different groups: the agonist, antagonist, and synergist. Which means, when I bend my elbow like this, my uh, biceps become the agonist, my triceps become the antagonist, and my brachialis muscle becomes the synergist. Which means, but when biceps contracts, the triceps should relax, right? And then the synergist actually support. So we should have this concept every time when we are dealing with range of motion issues, or when people are coming with stiffness, right? So there's a couple of stretch and release techniques, I'm just going to say. So for neck pain, when somebody comes with a neck pain, how do you treat it? Using trigger point therapy, So first we understand the anatomy and the direction of the muscles, and then we do the ICT, the ischemic compression technique on the middle trapezius, rhomboids, right? Locate and inhibit trigger points in the scalenes group, splenius capitis, and the posterior patient, and the ICT to the epicranius. So all these muscles need to be considered, right? So if you're doing a neck pain, first you need to do the scalenes, your posterior back, your suboccipital muscles. You have to check for tightness in all these areas. And once you find the tightness, what you do is you just do an ICT, and you release this area, right? And then you do the stretches, right? The stretches, you can see simple stretches, towel stretch, flexor stretch, the neck stretch that we all do. It's all very easy. The sternocleidomastoid stretch. So ideally, the rule for stretching is always you should release the muscle and then stretches. Otherwise, you're just overloading. And then chin tucks, that actually helps to free the cervical vertebra as well. And the fascia is the place to look for the cause of disease, and the place to consult and begin the action of muscle remedies in all diseases. Right? Now, fascia is something, we don't even spend 2 minutes or 3 minutes in our entire 5-year course, right? We just, during dissection, we just say, now we can see the fascia, we're just cutting and removing the fascia, that's it. What is a fascia? Fascia is a covering. And myofascia is the covering of the muscle. That's why it's called as a myofascia. That's it. And what happens is, in the human body, fascia is the structure that has more, or I would say second more number of sensory neurons as compared to the skin. Skin has the most number of sensory neurons. Fascia is the second structure in the body that, and because when we do a cadaver dissection, the fascia is just waste, it's nothing, so we don't really appreciate the fascia. We are focused on the muscles and isolating the muscles. But when you look at a human body, the fascia is the most important structure that actually connects the body from head to toe, from inside outside. Everything is interconnected through fascia, and most of the nutrients, everything is transported through the fascia. So the health of the fascia is what is of utmost importance, and this is something that we neglect because we're not aware of the structure. Yes, we do treatments, we find results, but where is this result happening? What is exactly moving? What is exactly shifting? All that happens through the fascia, right? And what is myofascia? Like I said, myofascia is the covering of the muscle, and it helps transport, move chemical and other substances around the body. Myofascia connects many of the areas of the body together, hence also referred to as connective tissue. Okay. And very interestingly, recently there is a big study that has come out, which is called as myofascial meridian, right? We talk about marmas, we talk about nadis, and all this were based on the functional aspects. And that is how ancient Ayurveda or Kalari Marma people knew what was marmas and nadis. So now the closest thing we can actually define anatomically or physically is trigger points and myofascial meridians. Now, I wouldn't say that marma is equal to trigger point. That's not my intention. What I'm saying is there is, if you understand trigger point is something which is on a very physical level. It is on the muscle, and myofascial meridian is something that is there throughout the body, and you can understand the movement of nutrients, etc. on this, and how the block of this channel actually affects your health, right? So we can understand what is the concept of marma and nadis, and these meridian maps may help to explain how and why a development of primary central trigger point in one area of the body may lead to a secondary or satellite trigger point. So I'm just going to quickly mention few. The name of the study is called Anatomy Trains. It is the most I would say, the most hot topic right now, most trending topic right now in the world of osteopathy, in the world of sports medicine. Everybody are looking for anatomy trains stretch, anatomy trains strengthening, all these functional lines. There's a lot of muscles. So you just need to type anatomy trains on YouTube. You will get all the information, a lot of information about anatomy trains, right? And what I would like to bring to your notice is the most common thing that we see in our clinics today, complaints like a CTS, right? A carpal tunnel syndrome. You have patient is coming with the pain. Now, there are just two tests for CTS. When they go to a neurologist, they do a nerve conduction study, and also they do this stretch and the filling test, and see if there is a pain in the carpal tunnel, and if there is a pain, if it's positive, which means they say there is a compression, so it's a CTS. And then directly they go for a surgery, and that's what the modern does, and that's when they come to an Ayurvedic doctor. And I've realized that, it's more than this. If somebody who has never used a mouse, somebody who's a housewife who has never, is never doing any job that actually causes compression, then it's more to do with fascia. And I would say it's the entire fascia that needs to be treated. So sometimes if you treat her chest area, if you see there is congestion there, and if you just release it, you can see almost instantly there is a pain relief in the CTS, in the pain in the wrist as well. So I'm not saying that all CTS pain is because of myofascial meridian, but I say that you should definitely consider this as well. If you know it, then even our treatment becomes very specific, right? And then there is this also. You can see the here DQ vein tenosynovitis right in the base of the thumb. The severe pain, it's all from the chest as well. You can just take the history from the patients. You can see that they'll also have pain from the chest or cervical for all this, right? And then of course our the superficial back arm line. And you can see that people come with conditions where they're not able to hold even small things, right? Vegetables, they're not able to hold vegetables while cutting, and a lot of complaints. And sometimes it's also almost just diagnosed as cervical spondylitis and all that, right? And the cervical back arm line, the deep back arm line of the hand, again, very common. You can see all these, and the pain pattern is along these myofascial meridians, right? And then the spiral oblique chain, you should understand that, it starts from the, see, you can see the spiral oblique chain here. It starts from the, sorry, yeah, it starts from the posterior cervical muscles, the rhomboids, the transverse abdominis, external oblique, and then it goes to the IT band, tibialis anterior, fibularis, and then it comes back to your semitendinosus, your hamstring muscle, and then goes to your sacroiliac joint, and then along the erector spinae muscles and inserts into the base of the neck. So you have these connections, and this is actually what, when there is a pull in this fascia, this is what happens when you have like an IVP, intervertebral disc prolapse, and then there is a shifting and there's sudden pain, the entire body just shifts. So we can understand how body's posture changes based on these myofascial meridians. And once you analyze the posture, once you identify the posture, you know the set of muscles that you need to identify, and you can correct it based on that, right? And the posterior sagittal chain is my favorite because, as Ayurvedic doctors, the biggest thing, especially in Kerala, we use so much of oil on the head, and there's always a big debate. What happens to the oil? Applying oil is like a very non-scientific thing that nothing happens to the head, etc. But we in Kerala we experience, because it's so humid, right? People just apply wrong oil on the head, and what happens is suddenly they're having pain in the lower back, they're having pain in the neck, they're having pain in the the knees, they're having pain in, like plantar fasciitis, all this. But you can see this is the one structure that is actually connected right from above your eyebrows and all the way back to your plantar area. Right now, the biggest structure that we see, after my practice, the first thing that actually started getting me patients was when I started doing Agni Karma for plantar fasciitis, right? So, and the plantar fasciitis, the typical sign is when people get up in the morning, when they get up from the bed, it's, there is a uh, pain and they're not able to walk, but after taking few steps, they're able to walk. Now, if you just look at this structure, you clearly know that what happens when people stand up from bed is the entire fascia line is stretched. And it is the plantar area, especially when there is a tightness. So, which means uh, now I don't do Agni Karma for plantar fasciitis because I feel it's only a symptomatic treatment. We are just treating the symptom and not the root cause. Because the main reason for plantar fasciitis mostly is because this entire fascia. So you need to correct the hamstrings also. You need to check if there's trigger points in the hamstring, your thigh muscles, lower back, your cervical area, your head, all this. And if you release the subox, sometimes you can see that sometimes when you release the cervical area, these muscles, even your plantar fasciitis also just disappears, right? So just sharing for info. And then there is the posterior oblique link. It's very, very important link, especially in mama massages and all that. Something called as a cross massage, where what two therapists, they will hold the opposite leg and opposite hand, and then there is a massage which shifts or crosses over at the thoracolumbar fascia, right? So, and the anterior sagittal chain, which includes your anterior group of muscles, right? So different set of myofascial meridians. The six set of myofascial meridians is very, very important for us to understand, because there is a lot we can do in this. And then this is the deep anterior chain, right? So the deep anterior chain has the psoas major, because when you're sitting, your hip flexors, your adductors, everything is tight, and and there are different, uh, let's say, back pain that people come with us, right? Some people come and tell you that they have a back pain and they're not able to bend forward. They have a pain in the back when they're bending forward. Some people will tell you that they have a pain while sitting up. When they're moving from sitting to standing, they have a pain. And some people are like, when they're sitting and standing, they're able to just lift themselves till certain point. After that, the body just doesn't release. Like, if the body is, it's 180 degrees, it just sticks. Yes, they're sitting. When they get up, it's just like this 130 degree. And from here, they need to lift like a 200 kg something, only then they get upset. And so it's the different muscles that actually are responsible for these different symptoms, even though all will be having a back pain, right? So when you understand, there are two type of muscles fibers. One is type 1 muscle fibers, which are postural and tend to respond to stress or overuse by shortening and hypertonic. And the trigger point that is present in the type 1 fibers take longer to respond to treatment. So type 2 fibers are built for explosive long-term activity and tend to become weak, atrophic, hypertonic under chronic and sustained endurance. A trigger point in a muscle with a high percentage of type 2 fibers may respond to more rapidly to treatment. So what happens is, if somebody is undergoing or doing a work in an improper posture for a continuous period, what happens is the trigger points are formed in those muscles and it will take more time to respond to treatment. But if the trigger point is in an active muscle, in a phasing, what happens is it sometimes immediately responds to treatment, right? So that is why when somebody comes with a low back pain, and based on the origin, based on the reset origin, or the, sometimes you just do a mild massage and Svedana, it's done. But sometimes if it's a chronic thing, then it takes more lot of time, right? Just how it is. So every, postural muscle tends to develop trigger points, and then it takes a lot of time to get treated as well, right? So why why do we need to understand? Because in this era of immobility, I would call, people are less mobile. Earlier days, people used to just to go from point A to point B, they needed to walk. But now what happens is that we are so connected, right from you get out of your house, you get a cab or a rickshaw or anything, and you just the walking is something is very less nowadays that we don't, right? And walking, we need to literally find time where we can go for walks. That's been a thing. And what that has done is actually, you're just sitting down so much, and all these muscles, when you're sitting down, there is a good slide that I'll just show you. We'll just talk about this. So, when we doctors, when you talk about spine, spine is like a very fragile structure for us, because we see the MRI, we see the scanning, and we just see, it's just kept on, and just do a small tap, everything will collapse together. That's why we get scared looking at, people manipulating, and, how it is possible to do all that. But actually, spine is a very, very strong structure with so many ligaments, and, you can see all the ligaments of the spine here. So, and what happens is, there is a connection. Now, there is something called as chiropractic, and there is osteopathy. Now, by now, I think you would have got an idea of osteopathy, which considers muscles, joints, ligaments, tendons, everything. Whereas for chiropractic, everything is the spine. If there is a leg pain, it is due to the nerve that is transferring from the lumbar area to that is supplying to that leg. So, if you correct the spine, it gets corrected. That's the difference between a chiropractic and an osteopathy, right? But when you talk about the sympathetic nervous system and parasympathetic nervous system, you have these individual, the not the cervical, but the nerves, that is the spinal nerves, that is responsible to the function, or that supplies uh, one particular organ, right? So T1, T2, T3, that supplies the lung, which helps in breathing. So if there is a congestion in that area, the thoracic area, then even your breathing is affected. The lumbar area is for the stomach. So if there is an issue in the lumbar area, then your digestion is affected, right? So there is now a lot of study about how there is a interconnectedness between the function of the spinal nerve and the organ as well. So when you consider the concept of tensegrity. Now, when there is I had a tensegrity. Uh, you see this, the muscles, how it is connected to a bone, right? The bone, and this is what we call the tension and integrity, which means the muscle actually creates the tension and places the bone on the specific spot, right? And then there is a compression and the tension, and which actually helps to maintain posture. Even though muscles, it's a very interesting concept we need to understand, because only then we will appreciate the importance of soft tissues or muscles in posture. In my mind, I think generally, if those who are not exposed to all this, we definitely feel that the bones are, in place, and the muscle is just connected to the bones from A to B. But in fact, the bones are in that place because of the muscles is holding those bones in that area. So literally the bones are floating in that muscles, right? And there is like how you see a tent or a shamiana. What happens is there is a pole, and then they tie the string, right? And to just pull the string very tightly to the all four corners, and that's when the pole stands straight. just like that. Even the pole is the hard substance, because and you can imagine the pole being the bone and the rope being the muscles, right? And that is how the body structure is. So uh, when there is imbalance in the muscle, it actually also creates an imbalance in the joint, right? So whenever you see a joint issue, it's not purely the bone, it's also the muscle that is more involved, right? So you have the compression elements and the tension elements, right? Now, when you talk about good standing posture, now when there is a very interesting, I'll show you a model, like when you consider IVDP. So I'll just explain it. Now, this is a very good model that I have in my clinic. I explain to my people when they come to me what is an IVDP, right? So what happens is, uh, when you understand the concept of tensegrity, these uh, these the vertebra is connected to the muscles, actually holds and connect these vertebrae in place. So when there is a tightness in one muscle, what happens? The tightness in the muscle actually causes this compression, right? The inter you see the multifidus rotator, something happened there because of some strain or sitting for too long or doing some overstretching these muscles. What happens is it actually causes more compression, right? And then you can see it's a very good model. So what happens when the muscles contract, it brings the bones closer, and then you can see that there is a small the 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 disc protrusion, and this is what is called as an IVDP, right? And so what happens in the modern perspective, they see an MRI, they see there's an IVDP, and it always needs an immediate. Right. So what happens to the muscle? It's not treated. But when we treat it, with Ayurveda, we just release these muscles, and when these muscles are relaxed, automatically there is a proper stretching to the vertebrae, and then the disc prolapse just tends to go back to into it. Right. That is how we treat it. Now, what you can add to these treatments are you can add muscle exercises as well, because now once you understand which is the muscle that is affected, you release the muscle, and then you can give strengthening muscles to these muscles. So that is why it is very good that if you understand osteopathy, or if you understand the biomechanics, along with your medicines, along with the panchkarmas that you do, along with treatment, you're getting a whole new aspect, or you're getting a whole new what do you say, you're understanding more about what actually is happening in that job, right? Now when you look at a good standing posture, you'll have a better idea about the muscles that is there, the bone that is there. I just want to and see how the facial thing is there. And there is a very good connection between trigger point formation and posture. You see old people coming with weak cervical flexus, and you see posture like that in old age, right? And it's so you need to identify there is a set of muscles that are tight, there is a set of muscles that are weak. So we identify the tight muscles, we release those muscles, and the weak muscles we give strengthening muscle exercises, exactly, right? And then let's talk about some common things that we see in a day, because this is relevant in your day-to-day life. And that's why we need to say it's not just meant for physiotherapists. It's not, because people come to you for an issue that could have been happened because of all these issues. So if you understand trigger points, if you understand osteopathy, then you can relate to what the patient feels, and you can treat them as well, right? Yes, and of course, you can also refer this to a good physiotherapist. Also, you can probably hire a physiotherapist in your clinic, and you can together you can do a very good. You can develop a good treatment protocol. So I just want to, there's something called as a good posture, right? And I'm sure you can see it, appreciated how you have to sit in front of the computer when you have to lift a bag, or something heavy. You need to bend your knees. You're not supposed to fold of bend forward. You're supposed to keep your spine erect, and you're supposed to lift it. uh, Common mistakes that everybody does, uh, it's like those it's like 2 days are off, so they would like to clean the house, and suddenly they're just lifting heavy things here and there, and then third day they just suddenly get a spasm, they come to the clinic. That is how I usually get it. And on the left hand side, you can see how this patient is sitting in front of the computer, and there is a lot of things that we need to talk about. Just another slide that is coming on the computer thing. So slouch, standing, all these different posture, and driving position. It is very, very common, right? the low cars, and if somebody is a 6-footer, if you drive something very low, and then there is a more strain on your lumbar area, and you need to address that, right? And so you need to educate people how to do. So here is another picture that when somebody is in a computer, what we realize that we are just focusing on the upper half of the body, which means the neck is forward, the shoulder is rounded, your hands are like this, and this is the only structure that we have in mind when you talk about on a computer. But actually, when you look, these blue color, the calf muscles are shortened. You have these hamstring muscles are also contracted, because what it is in a semi-contracted state. So when you're sitting like in that position, even your leg muscles is being affected. You can see your iliopsoas, all your hip flexors also becoming tight. So it's not just the cervical and the upper back muscle is affected when you're sitting, it's also your lower back muscles. So you can see that people who are continuously working also have tight hamstrings and tight gastrocnemius muscles as well, and which is also could be a reason for back pain, right? So what is an ideal posture? I'm sure you have all seen this picture. Just the screen should be just below the eye level. There is some this footboard should be there to support the ankle. It should be erect spine. And but actually, even now, this has completely changed, because people say that to develop a trigger point, you just have to be in that position for about 30 minutes. That's it, right? So the ideal posture when you're working in a computer is actually moving, which means if you're sitting and doing something for some time, then you need to stand and do, and then you need to lift the table. But now there are a lot of, stand where you can increase the height of the stand as well as the chair. So people are actually standing and working, sitting and working, that is the ideal posture. So there is no ideal posture as sitting and continuously doing, no, right? So it's all about movement. It's all about moving. So the only thing that you can tell your patients is, every 30 minutes, half an hour, try to just get up, try to do some stretches, at the back, all that, that is how you can do. So when you talk about these, there is posturological receptors and the central nervous system and how it is all connected, right? So you have these, when the posture is due to the imbalance in the muscle. So when you're talking about treating a scoliosis or something, you need to identify what is the muscle, but you also need to identify what are the posturological receptors, right? Which means your posture could change because if your say for example, if your vision is not proper, if somebody's vision is not proper, if the eye level is not proper, what happens is that the head will try to tilt, and the body idea is to always get that eye level parallel and try to gain back the center of gravity of the neck. So what it does is it will just shift the thoracic vertebrae a little bit, and then it will shift the lumbar vertebrae, and then it will make sure that the head is on a the maintains center of gravity, and the eye level and the eyes at the level. And but what that would do is it will develop a scoliosis, right? So when you treat scoliosis, it's not that simple. What happens is I've seen a lot of people, when you treat scoliosis, it's like they say the stretches wherever there is a, if there is a shift to the left side, then you just do a stretch on the right side. No, you have to address each muscle. You have to understand what was the main reason for it. You need to understand right from the very basic. So there is another concept that I just, got it from when I learned about visceral osteopathy, and I feel it's so related. And it talks about how a stomach inflammation or dysfunction, it causes diaphragm irritation. It irritates the phrenic nerve, and then phrenic nerve is an afferent. It takes signals towards your cervical area, and then there is local dysfunction and neck pain, right? And the C5 root dysfunction traveling in brachial plexus, referred pain in the upper limb. So even though pain is in the upper limb, the main reason is a stomach dysfunction. As Ayurvedic doctors, we know the importance of Agni, we know the importance of Deepna Pachana, we know the importance of Vata and Lomna. We give all this medicine, and we see that when we give those medicines, how quickly pain subsides. A Virechana, something, as simple as a Virechana. Yes. So you can see these connections and how the acharyas knew exactly what it was. But now you can understand it. That's the whole point. Before you were like, yeah, we are giving it, we are getting results. The acharyas are right. We do an aptodesha, we just stick to that. But now you can actually say what exactly is happening. That's the most important thing I really, liked about, osteopathy. The more I understood or learned osteopathy, the more I go to understand what Ayurveda really meant. And that is what, why I feel that everybody should understand or learn osteopathy. And if you look into the the world of manual therapy, if you look into the world of physiotherapy, if you look the world of osteopathy, vagus nerve stimulation, vagus. It's everywhere vagus nerve now. And because even vagus nerve is an afferent nerve, and it literally controls many of the aspects, right? From your happiness, your calmness, your digestion, everything is related to the vagus nerve, right? So, and that is why they have the concept of uh, gut brain axis. They talk about the brain and gut biome, and there is a lot of interconnectedness, the fascia, and how the gut is related to the fascia, how your gut has to be proper, maintained, only then how to improve. And you can see, we have seen a lot of sessions, even Gyan, you have the Purisha Parishas, and you have the Malaparishas, what Dr. Hima teaches, and Garasa teaches. It is very interesting that based on those, the based on the health of your gut, you can identify and you can actually clear so many things. Now, since modern world do not have any medicines as such that affects the gut, they are into probiotics, they're into laxatives, and that's it. They don't know that specific concept. But Ayurveda principles are so strong and fundamentals are so great that you have so many ample medicines and you can actually correct it. They have restrictions because now they focus on for the fascia and pain, they're focusing of diet and hydration. That's it, right? And so that's why there is a lot that we can actually contribute, as Ayurvedic doctors. And balance is the key in central nervous system. You need to have a balance of the sympathetic and parasympathetic nervous system, and that is how all this, balance remain. Now, this is another interesting concept that I would like to just keep introduce you all. There is set of mobility and stability factors, right? Now in your body, certain joints has to be mobile and certain joint has to be stable uh, to enable the normal function of the body. When you walk, I'll just start from right below and up. Yeah, we've got time. Just start from right below and up. You can see there is the toes has to be mobile. So when somebody is actually walking, I've got a very good model. So when somebody is actually walking, you can see, when he places his legs like this, right when he's walking, the the toes have to be very mobile. Only if it is mobile, it will absorb or distribute the weight of your body evenly, right? So when you walk, if your toes have to be mobile, right? And the feet has to be stable, because when you walk, you put your heel and you're walking, right? So if this area, this area is the feet, right? So it has to be stable and it holds, only then you will be able to walk. And then you have the concept, the ankle joint, because your calcaneus and your fibula, it is like a, I would say like a saddle joint, right? You have your calcaneus like this and you have your, so it's like this. So this has to be mobile. If this is not mobile, what happens then? Dorsiflexion and plantar flexion is not possible. So this this mobility has to be there. That smooth mobility only will enable walk. If anything is affected, then it is going to affect the entire body. For example, something happens. If somebody has a fall or somebody has this minor fracture, and they just do a POP and this toes, they become stuck in that position and are not evenly spreading or mobile when they're walking. And what happens is there is an uneven distribution of the weight, and from here it will start affecting the ankle or the knee or the structures above that. So that is why it is important that this has to be mobile, this has to be stable, right? And this has to be mobile, right? And then the next joint, what we want to talk about is your knee joint, right? And the knee joint is your knee joint. And this has to be rock stable, because your entire body is what do you say, your weight is on it. If when you talk about knee joint issues, when a patient comes to you, what do they say? Doctor, I'm not able to uh, give weight on my knee joint, or when I'm walking, I just feel that my joint is just unstable and just letting go. And so I don't have, so I'm not very confident in walking. These are the conditions that you see in your clinic, right? So the knee has to be stable, and then the hips has to be mobile always, because the hip is in your acetabulum, and it just needs to be mobile. The lower back has to be stable. That's why there is so much importance on core strengthening, core paraspinal muscles strengthening. And even in yoga, you try to have a very, you try to suck in, and then you try to create a good stability for your low back, because only if your low back is stable, because you don't have any other structure that gives it stability. And then you have your upper back, right? Your upper back needs to be mobile, because there is breathing happening, there is expansion and contraction of your lungs. So your upper back has to be, the ribs has to be very mobile, and there should not be very stiffness in the upper back, right? And then you have the shoulder blades, because when you're walking, the shoulder blade should be stable. Okay, and if the shoulder blades are stable, then your hands, when you're walking, that has to be very mobile. And then your stable lower abdomen and your upper neck should be mobile. Only then you'll have to look for. So you can just divide or distribute all the conditions that you see in your clinics now. It is based on all this. And ideally, till now, you were actually trying to get it into that position only, but we are not very clear about it. Now, from now, you should always focus on improving, for example, knee stability. If if the patient is having pain, he's definitely not going to have he's going to have a mobile knee. So no, that needs to be fixed. Recurrent knee dislocations, recurrent pain, right? What happens when somebody is getting up from a car? They just say that when they're getting up, suddenly they hear a click sound, and that's it. They're having knee pain. So we need to understand. We need to understand to how to mobilize that joint. We need to see how we can remove the stiffness from the soft tissue, release it, and then start strengthening for the knee joint, right? Ankle joint, what happens? Somebody who just twists the ankle, there need not be a fracture, there need not be a tear. What happens? That twisting ankle in that small thing will create a small pressure, and then what happens? The ankle that has mobile, actually it gets stuck sometimes. And when the ankle is stuck, people are not able to walk. That mobility stability, the dorsiflexion, plantar flexion is not normal. And what happens? It's stuck. So when they're walking, they can get heel pain, they can get knee pain, they can get back pain. So that is how it's all connected. And sometimes even if you are knee pain, what happens? You because of your knee instability, your body is adjusting in so much that sometimes you're getting a headache because of an issue in the knee pain. So that is how it is all interconnected, and body treats. So you identify which is mobile stable, and then you identify which is the weak link. So in this case, the thoracic spine is stiff. That is the weak link. So if the weak link is identified, we need to correct it. Otherwise, whichever link is weak, it will create a problem in the successive chains or the link as well. That is the whole idea, right? And how do you treat? What are the normal in a osteopathic view? How do you treat? Right. First, there are tests. You see a posture assessment. Right. First, you see the patient based on the posture. You identify, uh, both anterior, lateral, all those areas. You look for the imbalances. You note it down, and then you identify the muscles that are out of place, and you try to do it. And then there is a movement assessment. Like when people are walking, what happens is sometimes people are standing perfectly, but when you're walking, you can see there is a lot of difference. So there is, squatting is usually done for sports, and then you check for range of motion test, isolated strength test. And once you identify the set of muscles, what you do is based on the principle of trigger points, you can do sports cupping, you can do the myofascial release, tennis ball, like how we saw and what is known as IASTM is instrument assisted soft tissue mobilization, flossing technique, trigger point therapy, all this can be done to a soft tissue mobilization. Sports cupping, you can see it was made famous by, this swimmer. I'm sure everybody knows it, the Olympic gold medalist. And it was firstly became hit after the US team did it, right? Michael Phillips. I just forgot it for a second. Yeah. So you can see Michael Phelps here using a cup to post workout. It's for a rehab. Bodybuilders using it because when the muscles are being contracted, there's a lot of stagnation. There is a lot of lactic acid built up. And all these cupping therapy actually helps relieve it, right? So even in general public, there is a lot of issues that we can do with cupping. Then there is myofascial release with hand. This is just facial stretching. You can use massage guns. I use massage gun, on the patient. And then there are a lot of tools that is, these are trigger point balls. There is massage stick. There is foam roller. So many things that you can actually use to release muscles, right? And you can also use these balls. So what they're doing is they're just doing compression and releasing it, right? It's very effective. You can do it with the clothes on. You can do it in a lot of, these are sports patients, so they need more, rehab. And this is what is called as IASTM. And what they use a lot of apply oil and they just use a steel or a plastic thing to just make these mounts. This is what is called as flossing. They use an elastic band to actually, it's like they inhibit the, what do you say, the circulation, and then they make movements and then just release, and suddenly there is a gush of blood to that area and it relieves the just tightness. So, and then very famously done is kinesia taping. So we can all include this in our treatments. That's exactly what I'm saying. Along with the medicines that you're giving, along with, whatever therapies you're doing, you can actually mix a trigger point release along with your Abhyanga, or probably you can do the therapist, let them do the Abhyanga. You can just go to work on the specific muscles. You can apply your trigger point skills, and patients are going to be so happy because they feel these really effect almost instantly, right? So stretching is post-isometric, and I'm sure everybody knows what is an isometric stretching. I'll just give an example with that. Isometric stretching is like when there is a contraction of a muscle fiber without change in length of the muscle fiber, which means if I contract my biceps, you can see that there is a change in length. It becomes shorter, and this is called a normal contraction. In an isometric contraction, what happens is we give a counter force, right? We stop this muscle, and then you just ask the patient to contract. So there's a 25% power, and I can see there is a contraction, but it's an isometric, right? So there's no change in length. And the post-isometric relaxation is if you want to release a tight muscle, you do an isometric contraction, and then after 6 seconds, 5 to 6 seconds, you just ask the patient to release, and you're just stretching that muscle, right? And that is what is called as a post-isometric contraction. So if you have the knowledge about all this, and then there is, so the rule of osteopathy is always that first you need to make sure that soft tissue is mobilized first, which means you do myofascial release, you do cupping, you do ISTM, you do taping, all that you do, you make sure the soft tissue is completely taken care of. Only then do we go for a joint mobilization. We do not directly go for a joint mobilization. What happens more than not, people just suddenly have pain without proper assessment. Somebody comes and just does a manipulation. Suddenly you can see the pain increases, a lot of complication, right? So it's not like that. There is steps and how you can, and as doctors, when we do it, patients are more confident that, they're like, so at least he's a doctor. I prefer that doctor crack my neck rather than, a layman. But, and we can educate them. We can take it very slow. We first make them understand what the issue is and what we're trying to do. So we are doing the muscle releases first. We are teaching them to stretch, and then we are doing a joint mobilization. And then since we taught them to stretch, they need to do these stretches. So based on the posture of that person, based on the work that is being doing continuously, we need to do we need to suggest counter stretches that they can follow regularly that will help them balance what they've been doing in their work, right? So there is a in power band, this is called as a mulligan's technique, where they use a power band to just mobilize that joint. You know, technique, you use the biomechanics, and it's very easy to do. It's very helpful as well because you're just creating a force and then the patient does the movement, right? And so you're just, suppose if this wrist is stuck, you use a power band and you try to move it and try to get it back in place, right? The other option is, of course, manipulation or like what you call like a chiropractic adjustment. So it's there's a demo. So I'm just doing a small demo of the thrust osteopathic techniques. Just different areas and different methods.
but after this treatment, I just feel relaxed.
Speaking Malayalam. So when you come back to, this was something that I got from Dr. Vasan Lad's book on, Marma and acupuncture. It's a very good book. He compares between, and I got this info. There were techniques of Mama manipulations, Snehana, Swedana, Mardana, Pidana, which is deep pressure without oil, right? And which is also a type of Marma manipulation. Veshtana is nothing but bandaging. Lepana is applying medicine, some Thrashna, beating. Agni Karma, Suji Barna, Rakta motion. Suji Barna is like pricking something in a sharp oil. So all these were mentioned as mama manipulations. And you can see how closely it's related to, what we just all discussed. So we're almost done with the presentation, and we'll just come back and we'll have a small, QA if anybody has. And I'd just like to end, the famous Loka Ekam Shastra Madhyana Vidya Shastra Nishta Tasmad Bhavishya Shastra Vidyanti. And it's very simple that the more you study, I feel that the more I studied about osteopathy, the more I got to understand what Ayurveda literally means and how it actually effective it is. And I've been, in my practice personally, after attending, doing all these techniques, I'm getting very good results, and I'm actually training doctors, sharing my knowledge, and even they're also getting good results. Thank you so much. So we can have the QA session now.
Sure, sir. So, any of the doctors who have any of the questions can put in the chat box, or you can unmute yourself and ask for the question.
Can I ask a question?
Yes,
Yes.
sir.
There is a question like you mentioned about meridian. right?
Yeah. Yes.
Myofascial meridian.
Yes,
Is it
doctor.
similar to that of Chinese medicine meridian technique or something else?
I wouldn't say it is similar because there is a lot of study being done. Because Chinese has 12 meridians, and it is all based on different organs. So it is not the same. It is completely different. This is purely based on the anatomy of they are finding that there is a common link. They just dissected. They are finding there is a fascia that is connecting in a specific way. They just dissected it out and then they just recorded it. So it's not similar to the Chinese meridian.
Okay, thank you. And another question is when we are doing dry needling,
Yes, sir.
which kind of needles you usually use?
Acupuncture needles.
Sorry,
It's
acu needles. So
Yeah.
they are not hollow, I suppose. They are solids,
They are solids, yeah. It's contrary to what we
right?
do in
Okay.
it's not what how we use in Vidya Karma. It's purely just
Yeah.
pricking in there.
So do you keep it there for some period, or you just put it and immediately take
No,
it out?
about 10 minutes. About 10 minutes is
For 10 minutes.
yeah.
Oh, is it? And
So
is
when you
there
actually
anything like rotation, like clockwise or anti-clockwise or anything like
no, no,
that?
no.
No.
For dry needling, you just leave it there. But
Okay.
some
Okay.
people try to do like a to and fro motion, but that is you don't have to do it also. If you just leave
Okay.
it there, so
Okay.
you're getting good result.
Why I'm asking this particular question because in Vidya we just put that needle in and immediately we remove.
Yeah.
And the concept is completely different,
Yes.
right? And you see
Even
instantaneous result. You need
yes.
not keep for even minute also.
Yes.
And this clockwise, anti-clockwise kind of movement I have seen with my colleagues, those who are in Siddha medicine. Whereas in Ayurveda, we apply pressure to nearby points, not on murmur, because you're not supposed to work on murmur, but
Yeah.
nearby points.
Yes.
We just give pressure. Whereas in Siddha, they have these kind of techniques. So, is
Yeah.
there anything to throw any light from your side?
See, actually, it's very interesting that if you do a comparison study, you would find like that the trigger point that is here in this, let's say your middle trapezius, right? And you can see there is a there is a marma. If you know there is something called as Tamil vermology, like Siddha medicine they call it. So there is a marma that is called as Kakate Kalam. It is exactly that area. If you talk about acupuncture, there is GB 21 point. It's exactly that area, right? So there is, and also our I think the marma is also there. So there is a very similarity between how like the all the ancient traditional system found that there are specific points in the body that is more painful than the others. So and different system of medicine named it differently. Now, the trigger points is something that is come up new. It is very new. And what they've done is they're just using it based on the muscle. It's purely on the physical level. So it's very, I feel that, if you understand trigger point therapy, it is a good way to start your practice. So because a physical structure, you can actually do some manipulation there. And then when you study about marma, you understand it much better. What happens now is it is very difficult to understand the points of marma because there is angula pramana, right? So there is always a confusion which exactly is the marma. And that confusion is not there in the trigger points because you are very specific on which muscle you identify the point on that muscle and then you're inserting the needle. So it kind of changes according to that individual. It's not a fix. So if you say sternocleidomastoid, this entire muscle, the trigger point could be here, here, or here. But when you talk about marma, it's always here, right? So that's why I feel it's easier to understand trigger point therapy. And once you start practicing it, once you appreciate the meridians, and definitely you can see that what they actually would have meant in marma, and you can actually explore more on that as well.
Yeah, very true. And it can be complementary to each other.
Yeah,
But then
exactly.
one point to be added, what you have said, that it is not Anguli Praman, it is Swanguli Praman. Swanguli Praman. When a physician is working on patient, it is not his Anguli Praman.
Yeah, sure,
It is the
exactly.
Anguli
Yeah,
of the
it's
patient.
of
And
the
that is the
patient.
mistake which many a time people they do. And then
Yeah,
they'll end up with problems.
yeah, I
Right?
understand.
So
Yeah,
Swangushtolara Samhitam.
there is
So if
there
we
is
do that way, it is good.
yes,
Then there is no problem, and you can precisely locate the marma point, not marma point exactly, the point where it has to be worked out with whatever, whichever techniques we have been speaking about in Ayurveda, at least, because I'm
yes,
not really knowing about the osteopathy or chiropractic, but
yes.
it was very interesting and very informative session. Thank you. Thank you very
Yeah,
much.
thanks, Doctor. Yeah.
Dr. Sheetal, you can unmute your mic and ask the question to the sir.
I think, sir, Namaste, sir. I think uh, Ashish sir has asked the same questions, maybe. So I just wanted to know about is it a type of chiropractic or it is a different than the chiropractic or it is a
No, see,
amalgamation or
Dr. Chiropractic, like I said, when you talk about the principles of chiropractic, for chiropractic, they believe that everything is from the spine. Any
okay.
the entire the issue of the whole body, even if it's a area in the leg, it's actually from the spine. So chiropractic, their principles and philosophy is based only around the spine, whereas osteopathy deals with everything, head to toe. There is muscle manipulation, there is visceral organ manipulation, there is cranial sacral, the fascia and the skull manipulation. A lot of things is mixed in osteopathy.
Okay,
And
sir.
yeah, and yes, the techniques are somewhat similar. This is called as an osteopathic thrust technique, where you do a joint mobilization. It is very similar to chiropractic correction.
Okay, sir. Thank you so much.
Yeah, yeah.
Do we have any more questions?
One more question, last question rather. Do you use Ayurvedic medicines in your patients, or
Yes,
you
doctor.
just restrict yourself to osteopathy? And honest answer.
No, for me, this is an add-on treatment. It can never replace
Add on,
Ayurveda.
no? That's fine. That's fine. Great, great,
Yeah,
great.
and I
Okay.
always, because that's the whole idea. I try to introduce osteopathy as an add-on treatment to existing,
Yeah,
because our concepts of, like I've always said, no, our concepts of Pachana, Deepana, Mutrala, Vata and Lomana, it's next level. But you can show results to the patient when you do all these techniques. That's the only thing
correct.
we can
Correct.
add on. And I've
Good.
seen that
Great.
I can confidently stop patients taking painkillers, steroids, or in a very fast rate when I implement all these techniques as well.
Good. Good.
Yeah,
Thank you.
yeah.
Is there any more questions, or we can come to an end for the session?
And just a point that I would like to add, Atik. So,
Yes.
we just need to be, if we can really understand, everybody are, irrespective of the country, the region, everyone are trying to make life better for other people if they are in closely, associated with any medical system or anything. So they always come up with techniques or things that is easier for the patient, that is easier for the therapist, and it's been evolving. So what I'm trying to say is, we, even though the classical uh, treatment methods, everything is very effective, but now what happens is people lack time. You can't expect everyone to come like 7 days a week, to your clinic and take treatment and go. So when you add on these techniques and when you keep updating yourself with these modern improvements that people are making. Now, for simple example, I use what is called as a massage gun or a percussion massager. It's not a vibrator, it's like a percussion massager. And what it does is it actually helps me release spasm very fast. So somebody comes with an acute back pain or someone, I just use this percussion massager on the patient on his clothes, right? And then I just do it and almost instantly it releases. And then I give the internal medicines, and only if he gets a pain, he needs to come back after some time. So what that does is it has saved me a lot of time. I don't have to do an abhyanga. I don't have to make him remove his clothes. I don't have to apply oil, all that. And I give an oil, I tell him to go home and apply it and just eat it. So these are some few things that you can actually add on. And and if you see in Amazon, there is a lot of these percussion massages are on sale because number of people have started using it. There are sports people who are being educated about it, and they do use it for their rehabilitation. And since there is so many gyms opening, people are aware of it. And you have these Instagram posts by random people just talking about effect of all these percussion guns. You can buy it in your house, you can just massage it on your body and all that. So there are simple, you can sometimes make your treatment also very simple. So it's always good that we update ourselves with the latest technologies that is there. Somebody's raised the hand.
Shall I ask last question once again?
Yeah,
With
no, go
regards to
ahead.
this percussion massage, you said percussion massager, so there is any instrument, what you are trying to say,
Yeah,
right?
yeah, yeah,
Uh, do you have anything to show with
yeah.
you right
Just
now?
I just this.
Dr. Shine, can you switch off your video and switch it on again?
My video.
Yeah, it's frozen actually, so that's fine.
It's fine now.
Yeah,
Okay.
it's
Yeah,
fine, fine.
yeah,
Yeah,
yeah.
yeah,
So
fine.
so this is actually the percussion massager. Okay. So
Okay.
what it does is it has a, why it's called as a percussion is, see, it has a movement. It's not a
Yes,
vibrator, right?
vertical movement, right?
Yeah, it has like a
Okay.
vertical movement. And
Yeah.
there are good qualities percussion massagers, which is very heavily built, right? You will get up to like a 12 mm amplitude. 12 mm amplitude is like
Okay.
1.2 centimeter depth in the body. So if somebody comes to me with like a, for example, piriformis syndrome, and you know how that tight it is, how it is, and if it's a very stout person, to release it is like a headache. But for me,
Correct.
when I use these percussion massages along with cupping, and I've got result very fast.
Hmm. Because I remember when I had been to South Korea for one of my presentations, so there I had chance to take treatment with
Yeah,
their master,
yeah, that,
TKM, and in that he gave me this kind of technique,
yeah.
and
They use
I
this.
remember it really works. Yeah, it
They use
really
this.
works.
I think they should have used
But
like,
then he did it with hand. He has not
yeah,
used any machine. He
yeah,
did it with hand, but it was very quick tapping. What I can
yes,
say,
yeah,
with both hands, you can do tapping, tuck 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 tuck,
yeah. I
and
think
that is what also we use in our traditional Ayurvedic massage. Also, if we
yes,
see some techniques as
yeah.
mentioned by Bhosle, who is the doyen of massage system in Ayurveda, he has mentioned this kind of stuff.
Yeah.
And
I
in
think
even
even in my,
physiotherapy manuals also they are speaking about it.
yeah, physiotherapy now they are adding
Sorry,
massage
you were
into
saying
their,
something.
the physiotherapy, now they're adding massage into
Earlier it
their.
was not there.
It was not there.
Yeah,
Because they
yeah.
are seeing there is a limitation with the 10 unit allowed with, so now they are also, even the osteopathy thing has not come into their curriculum as that, right? But a lot of physiotherapists are actually learning it and they're practicing it. But in their curriculum also, it has not been included.
Yeah.
It should be there.
They are using dry needling also, left
Yeah.
and right.
Yeah,
In most of the
yeah, but
patients I have seen,
the
people are
point is
using
dry needling is not part of their curriculum.
major curriculum. Yeah, they add on. They use it. Correct.
They use it, yeah, they study after their, BPT, they go out and study it. So what, again, we really do not have to, be thorough with dry needling and keep doing dry needling for all the muscles. It's not possible as doctors. But what I'm saying is, for certain conditions, we can, if we know, if we can do it for the patient, and then probably you can refer to a physiotherapist who's doing dry needling. So once you know the effect of dry needling, then you can clearly.
Video is against
Video, is it fine?
it's not audible. Now it is audible.
Okay, sorry. What I'm trying to
The
say
video
is,
is stuck.
yeah, what I'm trying to say is, if we doctors, if we know all these techniques, then we can actually refer our patients for continuous treatment to a physiotherapist or someone who's doing all this, right? We need to be aware of all these techniques. That's the whole idea. And you can also do these techniques in your clinic for certain people who need, whom you can help. If there is just small area that you need to address, you can definitely do it, dry needling in your clinic. You don't have to refer them. So the people are also confident that, yeah, the best feedback I get about the thing is, people like, they have confidence. I mean, like, what, he'll figure out something to treat it. That's the kind of response they get. And and people like normally, like every Ayurvedic doctors get patients, especially for pain, you will get it after they've gone to a modern doctor and they've not found a proper solution. And the second option is Ayurvedic doctors. But now, when we've given the results, and now we are getting even patients as like a first reference itself.
True.
We have a last question, I guess, from Dr. Anju Chetia. Ma'am, do you have any question?
Hi. Hello.
Yes,
Sir.
ma'am, you're audible.
Hi.
Hello.
Yeah. Thank you very much for your wonderful session. I would like to know that do you use rope and belt therapy also in your osteopathy practice, like for correction of postures? And what do you feel about Iyengar yoga practices? Thank
It's
you.
very good. I'm just planning to study it now because I feel it's very good. Iyengar yoga practice and Iyengar open belt therapy is very good. What happens is, when you understand this concept, the Iyengar rope and belt therapy actually is very specific on certain areas. We can, I think especially for the knee manipulations, for correction of the knee joint, for the posture, you can definitely use Iyengar. But again, I feel that if I use probably trigger point therapy, I would probably release those muscles. And for the stretching part, then I would go to the rope and belt therapy. I wouldn't, because I see that there is a very, when there is somebody's coming with stiffness in the upper back, let's say, and there is a trigger point, I don't directly go for a stretching. I need to release it and then probably go for stretching. And I would ask the patient to do the Iyengar ropa as a, like in a, for a continuous strengthening basis. But it's definitely handy. You should definitely do it. And I feel that if you do, if you're thorough with the muscles, biomechanics, and then if you do Iyengar rope and belt therapy, it's more effective because you understand exactly what is happening.
Thank you very much, sir.
Yeah.
Thanks. Really appreciate.
Yeah.
I hope all the questions have been answered. So if we can just end up the session. As we take a wrap for today's webinar, I want to extend a sincere thank you to all, each and everyone for joining us. Your presence and engagement have made this webinar a success. A big thanks to Dr. Shine Mohan for an incredible insight and engaging session. Your expertise and passion have truly enriched your learning experience today.
Thank you. Thank you so
Thank
much
you,
for
Dr.
having me
Mohan,
over.
once again.
Yeah.
Thank you
Thank
so
you so
much.
much.
Dr. Shine, this is Anand here.
Hi, Anand.
Really a very big thanks. It was just a most amazing session, and we are really obliged by you spending time and letting us know in-depth details about this topic.
Yeah, I tried my best. Thank you so much.
Thank you so much, sir.
Yeah, thank you so much, sir.
Thank you, everyone. We can connect back in next session, hopefully next month again. Thank you, everyone,
Yeah.
and a very late evening to all of you.
Right.
Yeah. Very good evening to all of you. Thanks, everybody.
Thanks,
Thank
everybody. Thank you.
you.
Thank you, Dr. Mohan.